Hi there, Dr. Tony Ebel here, Pediatric Certified Chiropractor, and we are going to do a rapid-paced presentation on the topic of ear infections. So, what are the stats? What are we dealing with here? 9 million kids every year are diagnosed with ear infections. Over 8 million of those get a prescription. 85% of the kids in this country will have one ear infection at least by age 3, many more than that. It costs the U.S. healthcare system nearly $3 billion each year. And unless you've been living under a rock, we clearly have a healthcare system crisis problem. We spend more money than any other country by far to get the worst results with our health. And when that starts to affect our kids, that's no good. And this is a seemingly common small problem we're dealing with on this presentation, but it's a huge player into the bigger picture of why our kids are so sick. It is the #1 reason for the visit to a pediatrician's office, the ER, or the urgent care. Ladies and gentlemen, they are common, but they are not normal. So what is causing these? Is it really just your kid was born with not enough antibiotics? Is it really your kid was just born with the wrong set of eustachian tubes that were too horizontal or stuck in the wrong direction? They just messed up on the manufacturing line? Well, this is a short, fast, and furious version of this presentation, so I'm not going to expand upon that, but I am going to tell you flat, point blank, the answers to those are no. That is absolutely not the truth to what's causing ear infections. What chiropractors are obsessed with, the reason I'm having this conversation with you here, is that we like to say that our initials, DC, Doctor of Chiropractic, really stands for DC, Doctor of Cause. We are obsessed with knowing the cause between every single thing that we deal with, including ear infections, which is something I deal with daily, hourly actually, in our clinic, and we get tremendous results and have for years. And the reason we're really obsessed with cause is because if you know the pathway, the exact steps or ingredients or recipe that causes a problem, well, then you know exactly how to go about combating that problem and getting a child or a patient off of that path and getting them better. So here is what causes ear infections. #1 cause, bad plumbing or drainage of the eustachian tube. But what you must know about #1 is the cause of this cause is, again, just not bad manufacturing. Kids' eustachian tubes aren't put in the wrong place, the wrong angle, the wrong direction. Kids aren't meant to have ear infections. They didn't get faulty design. #2, this is the nerd one, but I will tell you I am a farmer and a nerd at the same time, so I'll teach this nerdy stuff to you in a farmer mentality, so it's super easy to digest and understand. #2 is a dysfunctional neurogastroimmune system. Starting with the most important one that runs the other two, the nervous system is interfered with. And when the nervous system gets interfered with, many other things get interfered with. #3, toxic inflammatory diet and environment that we currently have. We're living in a crazy, toxic, stressful world, and that is absolutely contributing to child's ear infection. So let's dissect #1. This will be the deepest, nerdiest stuff. So stay with me. We'll go fast and furious, but I promise it'll make sense. Right here, we are looking at an anatomical picture. It does not need to make any sense to you. You don't need to worry about much of anything other than at the very top here, these two words, tensor tympani. What that means is that is the muscle that is controlling the tension, therefore the opening and closing of the tympanic membrane, which is the inner ear, where the vast majority of ear infections arise. This muscle right here, shown in red, is basically the doorway, the open and close gateway to the eustachian tube, which is then supposed to drain all of the fluid of the middle ear, which is back here to the upper left, down the eustachian tube, into the back of the throat, and into the rest of the respiratory and lymphatic system. So all the junk and the fluid that may get in through the ear and other sort of places, because other parts of our plumbing system all combine in one place, go down into the gut where the stomach and our immune system. That's why gastroimmune, because the 60 to 70% of our immune system is in our gut, and most of the rest is in our respiratory linings, because that's how junk gets into our body. Not just bacteria, but viruses. So what happens if there is tension and stress and strain on this muscle? If it's not doing its job, if it's spastic and stuck, then it gets tense, and the eustachian tube gets stuck closed, or it gets constricted and therefore cannot drain very well. Well, what in the heck would cause that? Really, #1 and #2 out of these three causes, moms and dads, come from the same place and are kind of doing the same thing. The second thing that really causes that is irritation to the nerve that controls that muscle. And here's a very simple dynamic, just very simple understanding of how chiropractic works in this situation, how it's involved in this situation, and how, as you'll see at the end of this, we know so clearly that it should be the first resort for these kiddos struggling with ear infections, not the last resort, quote unquote, alternative resort. What happens, the way our anatomy, our nervous system, our physiology works, is that the job of the spine is not just a hunk of muscles, ligaments, and bones. It is a living, breathing, neurological conduit and connectivity system. Its job is to house and protect the delicate nerve tissue and spinal cord tissue that resides within it. The two most important vertebrae, because the most important aspects of the nervous system are located right underneath and within them, would be the top two vertebrae we call the atlas and the axis, or basically, simple understanding, the upper neck, and to some parts the middle part of the neck as well. These nerves, these wires, so think of your spine and your nervous system as your body's fuse box. Especially the wires from the neck are really the main breaker or the main fuse that really controls the power source from everything, aka the brain, which sits up inside of there, of course. But as those nerves, as those wires, as those fuses then send out those wires to the rest of the body, they go to all the pieces, parts, tissues, organs, and glands of the body. The nerves from the upper neck go to the middle ear and inner ear, and also happen to go to that muscle we just looked at 1 second ago, the tensor veli palatini, or the tensor tympani muscle. The nerves that control that muscle come from the top of the neck. If the nerves coming from the top of the neck are interfered or dysfunctional or stressed, or have all sorts of stress and dysfunction to them, they then create spasm and stress on that muscle, which creates stiffness and spasm, which gets the eustachian tube stuck closed, which then alters the plumbing and alters the function of the nervous system, the immune system, and the gut as well, because they all interplay and connect through all of these nerves, which go through the spine. So basically, this is as simple as if we mess with this thing over here, that is step A. If we injure, distort, and misalign these vertebrae, we then irritate and cause interference on these nerves. Then, if those nerves go to these tissues, organs, and glands, they start to malfunction or have dysfunction. They don't do their job very well. That is step B. If that tissue, organ, and gland happens to be the middle ear, and the middle ear is not draining and functioning as well as it should, well then step C, we might get ear, sinus infections, allergies, congestion, and many other related things. But in this topic, we're talking straight about the ear. But you might be asking yourself, okay, that makes sense, I get it, it's got bad plumbing, the nerve's not working, the muscle's spastic, it's not draining, it clogs up. But if we dissect these first two causes out of the three I gave you, we have to sharpen that magnifying lens, that case history, that background one more step, and ask the question, but what is causing the causes? I know that's a little bit goofy, that's a little bit of a tongue twister, but I'm telling you what's causing all of this at the very beginning is something that is happening to the vast majority of our children the moment, the day they show up here. And it is how we are birthing and bringing our children into this world. So that is a whole nother 90-minute workshop and presentation we do in our office called Delivered, where we dissect this problem in full. Do not have time for you on this rapid-fire ear infection workshop, but what you're about to see is a video of a C-section. Because I'm trying to do this and respect your time, I know we're all busy, especially with young kids, I don't have time to give you a big disclaimer. I know a lot of people don't like to see these sort of things. I know it can be rough to watch, especially if it's in your child's case history and your family's case history. Then it is nothing other than showing it to you because, as you've heard before in this metaphor, a picture's worth 1,000 words. Here in this day and age, just like you're watching this video to learn this information and hopefully finally see the crystal clear solution that is to get your child better and keep them well, I don't think a picture's worth 1,000 words anymore. I think a video is worth 10,000 words. We are in the YouTube age, so I kid you not, you're about to watch a YouTube video on a C-section delivery, so you can see where all of this begins.
Getting irritated. Oh, there you go, little fella.
Come on, buddy.
All right. Ears of a girl. Ears of a girl. Make you cute for the camera.
Oh, man. Keep coming back. You did good.
There he goes.
And how common it was for them to grab that child by his head and neck, twist, pull, and bring them into this world. Now, like antibiotics, is a C-section delivery sometimes an absolute life-saving, critical, amazing medical intervention? Absolutely. But by watching that video, I hope you can see where the nerves coming from the upper neck and the muscles and the structures and the systems that they supply and control and coordinate can be damaged right from birth. A typical case history we see in a child delivered like that when they're delivered via C-section, especially if it's emergency C-section or in other ways and interventions, forceps, vacuum extraction, those sort of things. The common pathway that we see is they have difficulty nursing, difficulty latching, they are colicky, they are refluxy, they have all sorts of spit up and vomiting issues, and within a few months at most, they start to have the ear infections and the pain. The pediatrician puts the scope inside, looks in, says they have an ear infection, prescribes them an antibiotic, further destroys their gut, further destroys their health, and away they go on a path which we call the perfect storm. Another main ingredient, really quick and simple and easy onto the perfect storm. The reason the cow pattern is in the background is cow's milk and dairy products are really, really good for baby cows. They're not really, really good for baby humans. So the inflammation and the inability to digest all of this sugar, dairy, grains, and preservatives and all sorts of crap that's in our environment, along with the fact that we are now antibacterial everything. We're taught to take a super soaker and blast our kids with Purell and antibacterial everything the moment they show up on Earth in fear of germs, and yet we're sicker than ever. So just a very quick look in at antibiotics. Too much of a good thing? Absolutely. Research continues to show they're mostly ineffective. And not only that, the research is very clear since the 1980s that they lead to an increased recurrence. The short-term side effects are gut problems, rash. They're no good, but the long-term side effects are worse. Again, I have an hour presentation I do on this topic before where we really expand upon this, but the fact is this is a public health crisis. Our mismanagement and just horrible misuse of a good thing, perhaps one of the greatest thing ever invented in medicine and really in humankind, antibiotics, because they truly are, has been used to such a detriment that we now have these superbugs, these antibacterial resistant bugs, MRSA, C. diff, and all these, that are now killing 30,000 people per year, costing $500,000, and it is soaring down a cliff that is so bad for the future of our children, especially when you go into a hospital, go into a place where you need to get help. So many then suffer from these horrible, horrible infections that just wreck their quality of life and take thousands of lives. And the worst one for your child right now, perhaps, the one that's much, much more common and gets happened to these kids, is especially if your child is given an antibiotic before the age of 1. Again, the research is clear that it drastically increases their risk of eczema, allergies, asthma, and other immune deficiency problems later on in life. If you just don't care about stats, just take a step back when you're out in public tomorrow or whenever you're watching this weekend. Just look at how sick kids are. When you drop your child off at school, when you take a look, unfortunately, especially if you're watching this maybe at just your own kiddos and you see how they constantly have the bags and the dark circles and the congestion under their eyes, and spring and fall and winter, they're just miserable. They're sick all the time. They get a cold for a month or an entire season instead of for a day or two. How come that is? Why is that the case? So finally, let me give you the answers. Let me give you the solution. And I want you to understand this. I understand that most people that think chiropractic is for back pain, neck pain, and headache, and it is good for that sort of stuff. It's just not our brand. It's not our specialty. It's not what we're passionate about. What we are the best in the world at is taking care of these kiddos and providing them natural, drug-free, easy, scientific-based solutions for these things. The reason you haven't heard about them before is because it's not in the toolkit of a pediatrician. The reason they are overusing antibiotics is not that they don't want to help. It's in fact they do want to help. But when you have a hammer, that's all you have in your toolkit, then everything looks like a nail. That's why they continue to use antibiotics, because they don't have the understanding of cause and nervous system functionality. They don't understand the role of subluxation and interference to the nervous system and to the spine in these cases. And even if they did, many pediatricians, I shouldn't say they do, many pediatricians do and make referrals to us left and right for ear infections, but most don't. And even if they did, they don't have the solutions within their toolkit or their hands that we do to take care of this. So let me just show you really quick and easy about the last resort solution. Why do I make that title on this slide, the last resort solution? Because unfortunately this is a joke we make and I don't really like. We joke all the time that our girls that don't answer the phones and take in the new intake calls for us up front should answer the phone. Welcome to the last resort. But we're working so hard. It's one of the reasons to try and put this video out there and to try and make it as quick as possible for you to digest it so that more people can get to this resort, the one that actually works, the one that is actually safe, the one that is actually drug-free and has science and technology to back it up, would then be the one that can be the first resort or at least an earlier resort for your child. 3 steps to no more ear infections for your kiddo. Number 1, improve the plumbing and drainage. Number 2, restore and improve the function to that nervous system, to the gut, to the immune system. And number 3, clean up the diet environment. Well, if you remember from the last slide, the second step of this, really number 1 and number 2 were caused by the same thing. That subluxation, that interference within the spine and the nervous system. It alters the spasm and the tension on that muscle, and it alters the function of the nervous system and the immune system and the gut. So those two things lead to the altered plumbing and to the altered immune function. They're caused by the same thing, so they can be corrected by the same thing. A specific neurologically focused chiropractic adjustment by a trained pediatric chiropractor. So first, let me show you how that works. It's as simple as this. First, we find the problem. We use a technology called the Insight Subluxation Station, which is advanced, incredible technology, just really cutting edge stuff that allows us through a non-invasive, as you can see on this picture on the left here, this is one of our docs doing a scan on a kiddo. That little handheld scanner is through temperature analysis and other forms of analysis. It is taking sensory readings from the spine, from the nerves and the muscles and the system within the spine. Not putting anything in like an MRI, a CT, or an X-ray. It is taking information from your child's spine and nervous system so we can see exactly where that clog, exactly where that dysfunction is. We like to say we don't guess, we test. Here is a very simple analysis of it. This is actually a kiddo from a couple of years ago. This is one of the scans, one of the first ones in my practice. I knew chiropractic was amazing for this work, but it was one of the first live cases that we took care of years and years ago. And again, we do this daily, multiple times per day. We help kids with this issue in our office. But this was G-Man. We, alter his, give him a nickname here to protect his identity. But very simply put, when these scans print out, you will see those nerves, you'll see those fuses, you'll see those wires right here. If the bar alongside that nerve and that spinal level is white, that's good. If it's green, that's mild irritation. If it's blue, it's moderate. If it is red, it is severe, significant subluxation and blown fuse. These nerves right here are the ones that go to that tensor villi, that tensor tympani membrane, muscle and membrane. They go to control the drainage of the neck and the eustachian tube and the lymphatic system, and they go to control the function of the nervous system and the immune system. So he had a severe subluxation. That's why by the time I first saw G-Man in my practice and he had heard about through referral what we do, he was already facing his 3rd set of tubes and had tons and tons of ear infections and antibiotics. And quick side note, this area right here is the upper respiratory or the lung area. He was also now starting to deal with chronic bronchitis, was getting pneumonia the winter before he started with us, because all of this junk, once they put the tubes and cut out the tonsils and the adenoids, there's nowhere to clog it and stop it up here. So they force all that fluid, that junk, that inflammation further down into the plumbing and into the system. That's why these kids now become lifelong asthma and allergies, and why 1 in 5 kids has allergies and 1 in 8 to 9 kids has asthma. And that is a major problem as well. This is where he was just 2 months later. I don't think it even took quite that much for G-Man. A lot of times we get these sort of results in 1 month or 2 at most, 3 for our most severe cases. White is good, interference clear, ears draining, healthy, happy, rocking G-Man. So what does it take to get that? Quite simply, the hashtag at the bottom of this full chalkboard view here is get checked. Call our office. Find out more information about how it works. It's simple. We go through a deep dive case history with you and your child. We go through and find the ingredients that cause their subluxation. We're likely to see the ones we talked about here today in this presentation. Then we run our scans, we run our examination, we find exactly where the subluxation and the interference is. Then we do all of that on one visit. We answer all of your questions, all your concerns. Then we take some time to put that all together, make sure we know exactly what the plan of attack is to how best take care of your kiddo. We bring you back on the next visit. We sit you down knee to knee. We show you the scans. We show you the findings. We tell you exactly what we found, exactly what it means, exactly how long we think it's going to take to repair and restore health for your child, and therefore get rid of the challenges that they may be having. So that is how the process works. We would love to do that for your child. If you're local to the Crystal Lake, McHenry County, Chicagoland area, we have many families that drive an hour or more to see us regularly to get our care for our expertise and our specialty. We would love to help you. Give us a call. If you are not local to our area and you find this through our website, Facebook, YouTube, Google+, anywhere and everywhere, and you need a pediatric chiropractor to provide these answers for your child, absolutely still get in touch with us at our office. I actually train along with another amazing pediatric chiropractor, now over 500 other trained pediatric chiropractors across the globe. So it's very likely that we can find someone that uses the same protocols, the same techniques, the same technology, and gets the same solutions we do close to your hometown. So no matter where you are, reach out to us. Get your child checked by a pediatric chiropractor. Get them scanned, get them evaluated, get them the answers so you no longer have to see them get ear infections.